Hi there, this is our second video in our supply restriction series. If you've not watched it yet, we recommend starting with the overview. And in that video, we introduce you to our patient Fred, who is not very good at responding to his invites. Now we're going to look at what happens when Fred requests his medication. If you're not already, we hope you start to get used to look out for this icon up here in the demographics status alerts. So it's a bottle with a green arrow. And if you see that, it means there's some kind of proactive check that's been identified that we'd really recommend running. You wouldn't necessarily want to do it on every patient because it can be a bit slow. If you forget, it's possible to have your practice configured so that it pings up and says, it looks like you forgot. But the best thing is to just click it when you see it. It's safer and quicker and easier to do that than go ahead and issue the medication and then be told you need to undo it. So here we see this patient's overdue their monitoring, and it's particularly for their ramipril. And it's advising me to call the patient to arrange the monitoring. And the reason it's doing that is because the patient's had an invite and access should be restricted if we can't book. Now, I appreciate that depending a lot on your role and your practice and how busy your day is, it may well not be possible to call the patient. We're only going to restrict access when they've had a recent invite anyway. But if you are able to, there is an opportunity here because we don't actually want to restrict access to medication, but we do want to make sure it's safe. So if you can, you'd click call to arrange, and that will take you through the steps to book the patient in. And there's other videos that talk through that. Let's say we can't get through though, or it's just not possible for me to call. I'm going to pick the option unable to call. So has this medication actually been requested? If there's lots of things on repeat and he's not asked for this, then that's fine. I'd put no. But most of the time, the answer is likely to be yes. So supply restriction. No current restrictions in place. So it's looked in the background at what's been recorded and nothing's been found. Recommend reducing to fortnightly prescriptions. Now, at each stage, if I'm really not sure, I can task the prescriber. But if your practice has said that they'd like you to go ahead and use this, then we'd recommend trying it because actioning now is going to give you some step-by-step instructions. Here I've got the step-by-step instructions. What the system's also done is popped out the repeats on a separate screen. This is not ideal for a video, but in real life, assuming you're using two screens, this can work quite nicely because you can have the information on one screen and then you can apply those step-by-step instructions on the other, which I'll try and do now. For argument's sake, let's assume atorvastatin hasn't been requested. In fact, he's never had that, so let's just work through the ramipril. So I right-click and select Amend. Again, that's going to pop out a different screen. I'm going to drag that over here. Make sure I've got the Automatically Calculate button next to Issue Duration enabled. So where's Issue Duration? Here, you can tell I don't use this often. And yep, I've got that clicked, that's fine. Set the duration to 14 days. So I can see at the moment we're going to give 20 capsules. If I now click somewhere else, if I press Tab, that tab's the better button on the keyboard. It's giving me this warning. Now I don't want to turn the calculator off. So great, that's now reduced for me the capsules. Obviously that's pretty straightforward. Say they were on 4 capsules a day and I change that duration from 28 to 14, it will do the maths for me. Press OK. At this point, it's frozen this bit out, so you might then need to say yes and come back and do the others, but you've at least then been able to follow the steps for that medication. Our own recommendation would be to apply it to all their medication rather than just the one that's sort of triggering the issue. But again, you might want to just do the one that's impacted, or it might just be the ones that they're asking for. So have I restricted access? Yes, I have. This has now generated this message to the patient. You're due an annual health check. This will include some important tests. So this is kind of covering the fact that actually both the annual review and the tests are due. You haven't responded to invites. For your safety, your prescription will only last 14 days. Please contact us to arrange an appointment. If you want to put extra information in, you can, but we're trying to just keep it short and simple. And I click send. Have I sent the message to the patient? Yes, I have. Yes, I've sent the annual review invite. Close that. If I come now to the tab Journal, just to show you, you can see the steps that have been followed. It's documented a lot of kind of what's been recommended for me. These codes, sort of picking up the fact that a blood test is due, we reduce it to 2 weekly, and now I would then issue the Ramipril. Apart from the fact that I can't, again, test patient messing up my video. What we'd recommend doing, you can try it on test patients in your own practice if this is new to you. You could perhaps do some in-house training with a pharmacist or prescriber and try it on a few patients as it crops up. Hopefully this helps make it nice and simple and very step-by-step and clear. But if at any point you're not sure, we'd recommend you task a prescriber, and then there's more steps for them to follow, which we'll cover separately.